Alzheimer's disease is a progressive neurological disorder that affects memory, thinking, and behavior. It is the most common cause of dementia, accounting for 60 to 80% of all dementia cases. Alzheimer's disease is more prevalent among older adults, with most cases occurring in people over 65 years of age. While the exact cause of Alzheimer's disease is not known, it is believed to be caused by a combination of genetic, environmental, and lifestyle factors. The hallmark of Alzheimer's disease is the presence of beta-amyloid plaques and tau tangles in the brain, which disrupt communication between neurons and ultimately lead to their death. Early signs of Alzheimer's disease may include forgetfulness, difficulty with language, mood changes, and a decline in cognitive function. As the disease progresses, symptoms may worsen and include difficulty with basic tasks such as dressing and eating, confusion, personality changes, and loss of mobility. There is currently no cure for Alzheimer's disease, but there are treatments available that can help manage symptoms and slow disease progression. Research into Alzheimer's disease is ongoing, with a focus on understanding the underlying causes of the disease and developing new treatments and therapies. While there is no definitive way to prevent Alzheimer's disease, there are several lifestyle factors that have been shown to reduce the risk of developing the disease, such as regular exercise, a healthy diet, and social engagement. Women are more likely to develop Alzheimer's disease than men, and this gender difference cannot be fully explained by differences in life expectancy. African Americans and Hispanic Americans have a higher risk of developing Alzheimer's disease than white Americans. A family history of Alzheimer's disease is a known risk factor for developing the disease. Sleep disturbances, such as sleep apnea and insomnia, have been linked to an increased risk of developing Alzheimer's disease. Traumatic brain injury, TBI, has also been associated with an increased risk of developing Alzheimer's disease later in life. A healthy diet, such as the Mediterranean diet, has been associated with a reduced risk of developing Alzheimer's disease. Regular physical activity has also been shown to reduce the risk of developing Alzheimer's disease. The presence of certain health conditions, such as high blood pressure, high cholesterol, and diabetes, have been linked to an increased risk of developing Alzheimer's disease. Chronic stress has been associated with an increased risk of developing Alzheimer's disease. Early diagnosis and treatment of Alzheimer's disease can help manage symptoms and improve quality of life for both patients and caregivers. Alzheimer's disease can be diagnosed through a combination of medical history, physical examination, cognitive tests, and imaging studies such as MRI and PET scans. There are several FDA-approved medications for the treatment of Alzheimer's disease, including cholinesterase inhibitors and memantine, which can help improve cognitive function and manage symptoms. Non-pharmacological approaches, such as cognitive training, physical exercise, and social engagement, can also improve cognitive function and quality of life for people with Alzheimer's disease. Caregiving for someone with Alzheimer's disease can be challenging and stressful, and caregivers may need support and resources to help them manage their responsibilities. Alzheimer's disease is a growing public health concern, with an estimated 5.8 million Americans living with the disease in 2020. This number is expected to increase to 13.8 million by 2050, as the population ages. The economic cost of Alzheimer's disease is also substantial, with an estimated $305 billion spent on care for people with Alzheimer's disease and other dementias in the United States in 2020. The Alzheimer's Association is a leading organization that provides resources and support for people with Alzheimer's disease and their caregivers, as well as funding for research into the disease. The global cost of dementia, which includes Alzheimer's disease and other forms of dementia, was estimated to be $1.3 trillion in 2019. Alzheimer's disease can have a significant impact on the brain, causing a reduction in brain size and affecting the function of several brain regions. Researchers are investigating the use of stem cells and gene therapy as potential treatments for Alzheimer's disease. There are several clinical trials underway to test new treatments and therapies for Alzheimer's disease, including drugs that target beta-amyloid and tau proteins, as well as immunotherapy approaches. People with Alzheimer's disease are at an increased risk of falling and sustaining injuries, which can further impact their quality of life. While Alzheimer's disease cannot be prevented, there are several steps that people can take to reduce their risk of developing the disease, such as maintaining a healthy lifestyle, managing chronic health conditions, and engaging in cognitive and social activities. Public education and awareness campaigns can help increase understanding and reduce stigma surrounding Alzheimer's disease, while also promoting early detection and diagnosis. Alzheimer's disease can affect people as young as in their 40s and 50s, although it is more commonly diagnosed in people over the age of 65. Alzheimer's disease not only affects the person with the disease but also their family members and caregivers. Caregivers often experience significant emotional, physical, and financial burdens. Alzheimer's disease is a progressive disease, meaning that symptoms worsen over time, and there is currently no cure for the disease. Alzheimer's disease can cause a range of symptoms, including memory loss, confusion, difficulty with language and communication, changes in mood and behavior, and difficulty with daily activities. Alzheimer's disease is caused by the accumulation of abnormal proteins, such as beta-amyloid and tau, in the brain, which leads to the destruction of brain cells. There are several different types of dementia, of which Alzheimer's disease is the most common, accounting for around 60 to 80% of all cases of dementia. The rate of decline in cognitive function varies between individuals with Alzheimer's disease, and some people may experience a slower progression of symptoms than others. The cost of caring for a person with Alzheimer's disease can be substantial, and the burden is often borne by family members and caregivers. In addition to medical and caregiving costs, Alzheimer's disease can also result in lost productivity and income for both the person with the disease and their family members. While there is no known cure for Alzheimer's disease, there are several potential treatments and therapies that are currently being researched and developed, and early diagnosis and intervention can help improve outcomes for people with the disease. Research into Alzheimer's disease is ongoing, and there is hope that continued progress will lead to new treatments and eventually a cure for the disease. There are several risk factors that have been identified as increasing a person's likelihood of developing Alzheimer's disease, including age, genetics, head injuries, and certain medical conditions such as diabetes and high blood pressure. While there is no guaranteed way to prevent Alzheimer's disease, leading a healthy lifestyle, including eating a balanced diet, exercising regularly, and getting enough sleep, has been associated with a reduced risk of developing the disease. Social engagement and mental stimulation may also help reduce the risk of developing Alzheimer's disease by promoting cognitive reserve, or the brain's ability to adapt and compensate for age-related changes. There are several different stages of Alzheimer's disease, ranging from mild cognitive impairment to severe dementia, each of which presents with its own unique set of symptoms and challenges. Alzheimer's disease can have a profound impact on the lives of those affected, including the person with the disease, their family members, and their caregivers. Support services such as respite care, support groups, and counseling can be helpful in coping with the challenges of Alzheimer's disease. There are several organizations dedicated to raising awareness of Alzheimer's disease and providing support to those affected by the disease, including the Alzheimer's Association and the Alzheimer's Foundation of America. As the population ages, the number of people affected by Alzheimer's disease is expected to increase significantly, underscoring the importance of ongoing research and investment in finding a cure for the disease.